Good morning to everyone. Myself Dr. Chandrashekhar Bhale. I am Professor and Head of Department of Pathology. I am going to deliver lecture on a very basic general pathology, that is necrosis and gangrene. Now whenever there is a damage to cell, it may be because of the any organisms or physical agents or bacterial agents, it will lead to alteration in the cellular environment surrounding the cells. Now this injury to the cell, it will lead to either a reversible change or irreversible change. Reversible change that you commonly seen in case of a degeneration like cloudy degeneration, hydropic degeneration, earlier changes of the fatty degeneration, but irreversible changes they are commonly seen in case of necrosis, gangrene, autolysis and apoptosis. So, what is necrosis? Necrosis, this word, it has been derived from Greek word meaning corpse, that is a dead body. In short, it is a cellular death. What is the complete definition? It is said that it is a rapid pathological death of the cells or group of the cells in the midst of living tissue. So, see, each and every word it has got its own importance. Now, the first thing, rapid. So, in necrosis there is a rapid death of the cells, because slow death it occurs in atrophy. Atrophy means that is a decrease in the size of the cell or organ. So, slow death it occurs in atrophy, so it is not necrosis. Second, it should be pathological death. So, first was rapid, second was the pathological terms, because physiological death it occurs in RBCs or squamous cells of skin. So, that is a physiological death. So, these are the two words, rapid pathological death in the midst of living tissue. So, the necrotic tissue or the dead cells it should be surrounded by the living tissue. That is the most important thing, because whenever there is a death of the cells in the midst of living tissue, it will irritate the surrounding normal tissue and it will act inflammatory cell infiltrates. So, that is a very important point as far as necrosis it is concerned, to differentiate it from the post-mortem death of the cells. In the post-mortem death of the cells, there is no inflammatory reaction, but in necrosis, inflammatory reaction that is present. Now, we have seen the complete definition of necrosis. Now, the question arises, why this necrosis occurs? So, what you call in pathology, that is what is etiology of necrosis? Why necrosis is caused? It is caused by multiple factors. The commonest factors, they are number one, physical agents like heat, cold, radiation. These are the common physical agent that causes necrosis. Second, chemical factors. Chemical factors, it may be organic or inorganic, or it may be because of the some endogenous agents, endogenous reagents that causes the necrosis. Third, that is commonly the most common cause is because of the hypoxia. Hypoxia means decreased oxygen supply to the tissue. That is commonly it is because of the cardiopulmonary, that is failure. It is commonly seen in case of the either cardiac failure or it may be seen in some particular pulmonary diseases. Next is anoxia. Now, this anoxia it is caused by either because of the thrombus or embolism. Then it is also caused because of the certain immunological reactions, that is commonly seen in case of the systemic lupus erythematosus, antigen antibody reactions, or it may be caused because of the certain dietetic deficiency like vitamin E or protein energy malnutrition. It is also seen in some genetic disorders. Genetic disorders commonly that is seen in case of the Down syndrome. We have seen what is etiology now. Now, next thing, what is the mechanism that is causing the necrosis? What you call it a simple language, that is what pathogenesis. The most common thing that is happening, that is a deranged cellular membrane permeability. The cell membrane permeability is altered, that will lead to formation of the necrosis. Second, there is a mitochondrial membrane damage also. Third, increased calcium influx inside the cell that causes the necrosis. Fourth, it is because of the decreased ATP synthesis, and fifth, it is because of the free oxygen radicals. Now, what happens exactly? I have told you, because there is excessive calcium influx that will lead to the mitochondrial damage. Now, as you know, mitochondria are the important sites of formation of the ATP. As ATP synthesis that is decreased, it will lead to loss of sodium pump. So, because of that, this sodium comes inside the cells. Along with sodium, calcium also comes, and because of that, water also it also comes, and that will lead to the necrosis of that particular cell. Now, we will see what changes they occurs and what you see under microscope as well as on the gross examination. Normally, a necrotic tissue is dull in appearance, it is whitish yellow in color, and it is opaque. Now, we will see what are the microscopic changes that occurs inside the cell. So, we will see first what are the changes that are seen in the nuclei, and secondly we will see what are the changes that occurs in the cytoplasm. In nucleus, three important changes that occurs. Number 1, pycnosis, second, karyorrhexis, and third, karyolysis. Then what is meaning of pycnosis? Pycnosis means the nucleus becomes, it is a dried drop of ink. It is because chromatin clumping that will lead to formation of this pycnosis. As you know, the nucleic acid, it is basophilic, it attracts the hematoxylin and it becomes a blue. So, that is what you call it as a pycnosis. It is because the nuclear sap, it disintegrates and nucleic acid, it comes out of that sap. So, that is the basic pathology behind the pycnosis. Secondly, karyorrhexis. What is meant by karyos? Karyos means nucleus and rhexis means fragmentation. So, when there is a fragmentation of the nuclei, what you call it as a karyorrhexis. This is because the nucleic acid content of the nucleus, they are scattered all over the cytoplasm, leading to karyorrhexis. Third is karyolysis. Karyolysis means there is a lysis of the nuclei. The nucleic acids or the nucleic acid DNAs, it are disintegrated because of the proteolytic enzymes, and that will lead to the disappearance of the nuclei. So, these are the three important changes that are occurring in the nucleus. First is a pycnosis, second is a karyorrhexis, that is a fragmentation of nuclei, and third is a karyolysis, that is a disappearance of the nuclei. So, these changes that will be seen in the nuclei. Now, we will see what are the changes that are seen in cytoplasm. In cytoplasm, three things are happening. Number 1, first there is a first well marked hyalinization of the cell, second, bursting of the cell, and third, appearance of the myelin figures. Now, this is because it attracts the eosinophilic stain, it looks like a pinkish structures. So, pinkish hyalinized eosinophilic structure, that is a characteristic feature of the cytoplasmic changes in the necrosis. Second, cell bursting occurs, it is because damage to the cytoplasmic membrane. And third is a formation of myelin figures. These are myelin figures are nothing but unmasked phosphatides that will lead to formation of the myelin figures. So, after etiology, after mechanism, we will see what are the biochemical changes that occurs and what are the sequelae of necrosis. As far as biochemical changes they are concerned, basically whatever so there is a present in the cytoplasm, that is mainly the enzymes and proteins, they are liberated out of the cell, and that will lead to increase in these enzymes. For example, when there is a liver necrosis, liver cell necrosis, the transaminase enzymes, alkaline phosphatase, that is raised and that can be detected with the help of your routine biochemical test. Second example I can put, that is commonly seen in the myocardial infarction, in which the creatinine phosphokinase and CPK-MB that is raised. It is also seen in muscle necrosis when creatine kinase that is also increased. So, these are the multiple biochemical changes that are occurring after the necrosis. Next is what is the sequelae? What happens next? If the focus of the necrosis is small, then that will be disintegrated, that is taken up by the macrophages, and that focus that is completely removed. But when the focus is large, it will lead to formation of the inflammatory cell reaction. After that, there occurs a formation of the granulation tissue. That is what you call it as a organization. In organization, you will see that tissue that is replaced by the fibroblast, their congested capillaries, as well as inflammatory cell infiltrate. Or the latter sequence is that becomes completely calcified, what you call it as a dystrophic type of the calcification. Now, we will see what are the types of the necrosis. Type of the necrosis, it depends upon what is the morphology, what is the causative agents, whether hemorrhages are present or not, and which. Then we will see what are the types of necrosis. Now necrosis types, they depends upon which tissue that is affected. Second thing, whether hemorrhages are present or not, and what is the etiological agents. So depending upon that, there are multiple types of necrosis. The first common is that is called as focal necrosis. Now what is focal necrosis? Means when the necrotic focus is small or tiny, it is visible only under microscope, you call it as a focal necrosis. That is very commonly seen in case of the liver. In the liver, you will see that there is a piecemeal necrosis or there is a focal necrosis, small foci of the hepatocytes, they become necrotic, what you call as a focal necrosis. That is commonly seen in case of the chronic active hepatitis. Now second type of necrosis is called ulceration. Ulcer, it is a breach in continuity of either mucous membrane or skin. So decubitus ulcer is one type of ulcer, it is present on the bony surfaces and that is commonly seen in old people and emaciated people because of the protein energy malnutrition. Third, the most important type, that is called as coagulative type of necrosis. This is commonly seen in solid organs like kidney, spleen, liver, etc. Here the commonest cause is because of the ischemia. It is on gross, dull in appearance, yellow in color, and it is pyramidal in shape. Now the pyramid, the broader surface is towards the periphery and the small surface is toward the apex. Now what is basic cause of this coagulative necrosis? It is because of the ischemia. It will lead to increase in capillary permeability. This capillary permeability increase will lead to exudation of the plasma along with the coagulant agents that will lead to coagulation of that plasma and the groups of the cells. So that parts it becomes coagulated and that is why it is called as coagulated type of necrosis. This is commonly seen in kidney, in which the microscopic pictures are very typical, in which you will see that the all cell border that is maintained but that is without nuclei. So it mimics like a tombstone appearance. Only you can identify who has buried there, that is called as tombstone appearance. Next type of necrosis, it is called as causative type of necrosis. Remember that causative necrosis is a hallmark of tuberculosis. So whenever you are seeing the causative necrosis, think about the tuberculosis. As tuberculosis is very common in India, you should not forget these things. Now what happens, it is a type of coagulative necrosis, but only thing is that there you will see that no cells border that is identified there and it is a cheesy in appearance. That is the meaning of caseation. Caseation means cheesy. Why it is seen in tuberculosis? Because the tuberculous bacilli, you will see that there is a high lipid content in the cell membrane. Now this type of necrosis, it is also seen in syphilis, that is in the gamma. So these are the varieties type of the caseation necrosis. We will switch over to the next type that is very important, that is called as fat necrosis. Now this fat necrosis that is commonly seen in abdomen as well as injury to the breast tissue. So there is a necrosis of the fat. Now what is the pathogenesis of this fat necrosis? This is commonly seen in case of the acute pancreatitis. So whenever there is acute pancreatitis, the enzymes like trypsin as well as amylase, lipase, they are liberated out. Now this trypsin, it causes damage to the cell membrane. Amylase and lipase, it causes the segregation of lipid into fat and glycerol. Now glycerol that is absorbed in the blood, while this fat it combines with the calcium to form the soap, and that is the basic pathology behind the formation of the fat necrosis. Now in fat necrosis you will see that there is a loss of nuclei in the adipose tissue. That area it is infiltrated by the inflammatory cells. Along with that, the foreign body giant cell, they are also present in fat necrosis. Fat necrosis is also seen in trauma to the breast tissue as well as other tissue, subcutaneous tissue, in which the fat tissue is abundant. Next, that is called as collicutive type of necrosis. It is also called as liquefactive type of necrosis. That is commonly seen in the organs which are not rigid and it contains high amount of the lipid as well as high amount of the enzymes. That is commonly seen in case of the brain. So in brain abscess, you will see a typical coagulative type of necrosis. It is also seen in amoebic type of hepatitis. Also it is seen in case of abscess. Abscess means localized collection of the pus. So, it has got a caseating, it has got the cavitary formation in which you will see the formation of the pus. Last type of necrosis, it is called as fibrinoid type of necrosis, in which you will see that the capillaries, vessels and interstitial tissue that is commonly involved. It becomes eosinophilic and hyalinized, and that is very commonly seen in case of various types of the collagen disorders like systemic lupus erythematosus, also in case of the rheumatoid arthritis, Raynaud phenomena and others collagen disorders, it will lead to formation of the fibrinoid type of necrosis. Now, we have seen about the necrosis, then we will switch over to the next topic, that is the gangrene. What is meant by gangrene? Gangrene is nothing but it is a massive necrosis to which putrefaction that is added. So, what is putrefaction? Putrefaction means it is a decomposition of the tissue because of the saprophytic bacteria. So, this gangrene, that is commonly what you will see, there are two types of the gangrene. One, it is called as dry gangrene, and second, it is called as a wet gangrene. So, what is etiopathogenesis? The basic thing is that it is either because of the severance, that is a cutting of the either arteria or vessels, that will lead to gangrene. Second, it is because of the deposition of either thrombosis or emboli in the artery. Third, when there is outside pressure that is causing the pressure over the arteries or the veins, that will lead to gangrene. So, these are the multiple factors which will affect the circulation to the tissue, and it will lead to formation of the gangrene. Now, gangrene, if you see microscopically, the areas are very large. Second, they are black in color, and third, they are foul in smelling. So, why it is black in color? It is because hemoglobin that is liberated out from the RBCs, this hemoglobin, it combines with the putrefactive agents like hydrogen sulfide. So, it will lead to formation of iron sulfide that gives a black color. So, why it is the foul smelling? The reason behind the foul smelling is that because of the saprophytic bacteria, there occurs the decomposition of the tissue that will lead to liberation of various types of gases like indole and scatol that gives a typical foul smelling. Third, you can feel or you can palpate the typical air crepitants in the gangrenous tissue. This is because there occurs the fermentation of the glucose that will lead to liberation of the gases, and that causes a formation of the crepitations. Now, what are the important two types of the gangrene? First is called as a dry gangrene, and second it is called as a wet gangrene. Now, this dry gangrene, that is because commonly seen, it is because of the obstruction of the venous flow, while the arterial flow, when it is obstructed, it will lead to the moist type of gangrene. Slow circulation of the arteries, it will lead to dry gangrene. So, what is difference between a dry and a wet gangrene? Dry, it is a small, shrunken and shriveled in appearance, while the wet gangrene, it is large, it has moist in appearance. The line of demarcation that is present in between a gangrenous part and a normal part, while line of demarcation, it is absent in case of the wet gangrene. Third important point is that pathogens, they are not found in the dry gangrene, while pathogens, they are formed in case of the wet gangrene. The prognosis is comparatively good in case of the dry gangrene, while the prognosis is poor in case of the wet gangrene. Now, we will see what are the different types of the gangrene that will be seen. It is commonly seen in either limbs or the intestinal organs. So, we will see one by one which are things that are seen in the limbs. In limbs, it is most commonly seen that is called as senile type of gangrene, that which is commonly seen in case of the old age. The common reason behind is that it is because of the atherosclerosis. Now, this atherosclerosis, it will lead to decreased blood supply to the fingers or the extremities, and it will lead to formation of the gangrene. Second, it is commonly seen in case of the diabetes, but in diabetes, it may be like a moist gangrene. Here, because there occurs fermentation of the sugar, that will lead to formation of gas, that will lead to a moist gangrene in case of the diabetes mellitus. Thirdly, it can be seen in TAO, that is also called as Berger's disease or thromboangiitis obliterans. There is a segmental inflammation of the arteries, vessels and surrounding nerves, and that is commonly seen in the people who are either smoking or taking a tobacco in a large amount. That is commonly seen in Indian peoples and Southeast Asian peoples, that is called as thromboangiitis obliterans. Next, it is commonly also seen in case of the ergot poisoning because of the fungus that causes ergot poisoning lead to the gangrene, dry type of gangrene. It is also seen in case of Reynolds phenomena or called as frostbite, in which the fingers and the extremity fingers, they are commonly involved in case of the high cold areas, in which you will see that there is a gangrene of the periphery of the fingers. Now wet gangrene. Now wet type of gangrene that is commonly seen in intestines. Most commonly it is encountered in strangulation, then intussusception and volvulus. Strangulation, that is commonly seen in hernia, because the hernial neck, it is small in size. This hernial neck, it will lead to strangulation of the intestine. The venous flow, that is obliterated. Later on there occurs edema, and it will lead to the obstruction of arterial flow also. So slowly the bacteria from the intestine, which are the saprophytic in nature, they cause gangrene of the intestine. Secondly, that is commonly encountered in volvulus. In volvulus, there is a twisting of the artery. Now this twisting of the intestine, that will lead to the formation of the volvulus, that is commonly seen in sudden spasm of the artery. It will lead to the twisting of the intestine, giving rise to the wet type of gangrene. It is also seen in case of the intussusception. So what is this intussusception? Intussusception means one part of intestine that is telescoped into another part, giving rise to the wet type of gangrene in intestines. So these are the three common causes in which you will see the wet type of gangrene in the intestines. One variety that is called as necrotizing fasciitis. It is also type of gangrene in which subcutaneous tissue, it gets necrose as well as there occurs a gangrene. And last is the Fournier's gangrene. This Fournier type of gangrene, that is commonly seen in the skin of the scrotum as well as some part of the penis and perineum. So these are the varieties of the gangrene that can be seen, but the most important, they are either dry or wet gangrene. One type of gangrene that is called as gas gangrene. Now this gas gangrene, that is commonly seen in case of the infection by the gas forming organisms like Clostridia. So this type of gangrene, it forms excessive of the gas, it forms, there occurs a fermentation of the sugar, it will lead to formation of the gas gangrene. So what is the take home message? What is the important thing which you should not forget as far as the necrosis and gangrene is concerned? Necrosis is a rapid pathological death in the midst of the living tissue, that is the first point. So what are the important changes that are seen in the nucleus and cytoplasm? What are the types of the necrosis which you should not forget? Importantly, you should not forget the hallmark of tuberculosis, that is a caseation type of necrosis. As far as gangrene that is concerned, two important things you should not forget, that is dry gangrene and wet gangrene. Dry gangrene has a good prognosis, wet gangrene has a poor prognosis. Line of demarcation that is commonly seen in dry gangrene, but it is not seen in case of the wet gangrene. So that's all about the necrosis and gangrene. Thank you very much for the patience listening.